But what does science actually say? In this video, we're going to cut through the confusion and give you the medically accurate truth about exercising during pregnancy. So, if you're expecting or know someone who is, stick around to learn how to keep both you and your baby healthy and safe. Major medical organizations like the American College of Obstetricians and Gynecologists, also known as ACOG, and the World Health Organization, or WHO, have clear guidelines on this topic. And here's the good news. They both agree that for most women, exercise is not only safe during pregnancy, but is actually highly recommended. The key phrase here is uncomplicated pregnancy. If your doctor has confirmed that your pregnancy is progressing normally without any specific health concerns, then incorporating physical activity into your routine is generally considered beneficial. These recommendations are based on extensive research and are designed to support a healthy pregnancy journey. So the professional consensus is a clear yes, but with the important condition that it's approved by your healthcare provider. So why is exercise so important? What are the actual benefits? Well, they're quite significant. First, regular, gentle exercise improves your blood circulation. This is fantastic because it helps reduce common pregnancy discomforts like swelling in your legs and ankles. It also strengthens your heart and helps it pump blood more efficiently for both you and your baby. Second, it's a great way to manage back pain. As your baby grows, your center of gravity shifts, putting strain on your lower back. Strengthening your core and back muscles can provide much-needed support. Exercise also helps control weight gain, keeping it within a healthy range recommended by your doctor. And let's not forget the mental health benefits. Physical activity releases endorphins, which are natural mood boosters, helping to reduce stress and anxiety. Overall, staying active supports your total well-being, preparing your body for labor and postpartum recovery. But what about the baby? This is the biggest worry for most mothers. Will my movement harm them? The answer, based on scientific research, is no. Safe, doctor-approved exercise does not harm the baby. In fact, it can be beneficial for them too. When you exercise, your heart rate increases and blood flow improves throughout your body, including to the placenta. This means more oxygen and nutrients are delivered to your growing baby. A steady supply of oxygen is crucial for healthy fetal development, including brain and organ growth. Studies have shown that mothers who engage in moderate exercise often have babies with healthier birth weights and even stronger cardiovascular systems. So instead of being a risk, the right kind of physical activity actually creates a healthier environment for your baby to thrive in. Now, let's talk about who is generally a good candidate for exercise during pregnancy. If your pregnancy is considered low risk and healthy, you're likely in the clear to get moving. What does a healthy pregnancy look like? Typically, it means you've had normal ultrasound reports, showing the baby is growing well and the placenta is in a good position. It also means your blood pressure is within a normal range, and you haven't experienced any concerning symptoms like persistent vaginal bleeding. If you were physically active before pregnancy, you can usually continue your routine with some modifications. If you were not active before, you can still start, but it's essential to begin slowly with gentle activities. The golden rule, always, is to get the green light from your doctor first. They will evaluate your personal health history and your current pregnancy status to give you tailored advice. On the other hand, there are certain situations where exercise must be avoided or strictly limited. These are typically high-risk pregnancies, where the main priority is ensuring the safety of both mother and baby. For example, if you have a condition called placenta previa, where the placenta covers the cervix, exercise is usually not recommended because it can increase the risk of bleeding. Other conditions include a high risk of preterm labor, certain types of heart and lung disease, or severe anemia. If you're carrying multiples like twins or triplets, your doctor might also advise you to limit activity. In these cases, your doctor's guidance is absolute. Other conditions include a high risk of preterm labor, certain types of heart and lung disease, or severe anemia. Never try to push through if you've been diagnosed with a high-risk condition. Safety always comes first. So what are the best and safest exercises to do during pregnancy? The focus should be on low-impact activities that maintain your fitness without putting stress on your joints or your baby bump. Walking is a fantastic choice. It's easy, free, and you can do it almost anywhere. It gets your heart rate up without any jarring movements. Prenatal yoga is another excellent option. It's specifically designed for the pregnant body, focusing on gentle stretching, breathing techniques, and postures that can ease discomfort and prepare you for labor. Speaking of preparation, pelvic floor exercises, also known as Kegels, are crucial. They strengthen the muscles that support your bladder, bowel, and uterus, which is vital for preventing issues during and after birth. And if you have access to a pool, swimming is wonderful. The water supports your weight, making you feel light and taking all the pressure off your back and joints. Just as important as knowing what to do is knowing what to avoid. Certain exercises are not safe during pregnancy because they pose a risk of injury, falls, or reducing blood flow to the baby. First, avoid any heavy weightlifting that involves straining or holding your breath. This can increase pressure in your abdomen and is not recommended. High-impact activities that involve a lot of jumping, hopping, or sudden changes in direction should also be off limits. This includes things like high-intensity interval training or certain aerobics classes. Contact sports are a definite no. Activities like soccer, basketball, or anything where you could get hit in the abdomen are too risky. Also, after the first trimester, you should avoid exercises that require you to lie flat on your back for extended periods. This position can cause your uterus to press on a major vein, which can reduce blood flow to your heart and to the baby.